Hello everyone, welcome back to my YouTube channel. On today's video I'm going to teach about ovulation. You can take a look at the diagram. You will see your female reproductive system, you will see your two ovaries, the fallopian tube, the cervix, the vagina. You will see everything. On this very video I'm going to teach about ovulation. As a woman who is trying to conceive, it's very important that you understand when you are ovulating, because some women fail to conceive because they miss their ovulation day and they don't even know the signs and symptoms of this ovulation. They cannot look at their body and know that I'm now or I'm about to ovulate. So stay tuned and keep on watching. To my wonderful viewers, you're highly welcome. My name is Blessing and this channel is all about human health and everything that concerns women's fertility. Number one, what is ovulation? Ovulation is when a mature egg is released from the ovaries. After the release, the egg will now enter into the fallopian tube and stay there for 12 to 24 hours where it can be fertilized. And according to the researchers, this ovulation occurs 14 days before the next of your menstrual cycle. And every woman's cycle length differs, so as the ovulation day and the menstrual period are different. So if you have 28 days cycle, if you have 28 days cycle, for you to get your ovulation day, you will do 28 minus 14 days. It will give you 14. So as you will do in other cycle lengths, if you have 29 days cycle, just minus 14 days from it. The answer that it gave you is your ovulation day. The same thing with the 30th cycle, the 31st, the 35, 21, 22, 25 cycle lengths. But anything that is below 21 and longer than 35 is abnormal. You have to see your doctor. So every month an egg is being matured from one of your ovaries, and after they mature, the egg will enter into your fallopian tube towards waiting for sperm and the uterus. And by this time the lining of the uterus has thickened to prepare for the fertilized egg. So according to the researchers, sperm can stay in the female reproductive system for 5 days. As a woman who is trying to conceive, having sex 5 days before and on the day of ovulation will help you to conceive immediately, because there is high chances of getting pregnant when there is already a live sperm in the fallopian tube. So as the ovary is releasing the egg to the fallopian tube, all two of them will now mate and fertilization will now begin. If no conception occurs, the egg will now die and be absorbed by the uterine wall. When the time of menstruation comes, both of them will now shed. Both of them will now shed. That is, the unfertilized egg and the uterine wall will now shed in form of your menstruation. But there is a situation whereby some women menstruate but they can't ovulate, thereby making it impossible for them to be pregnant or for them to conceive and have their baby. So these women will tell you that they used to see their menstruation but they are not getting pregnant. Yes, it's very possible, and this is because of some fertility issue you are having. Because medically definition, you technically can't menstruate without ovulation, but you can still bleed. And this bleeding is called abnormal uterine bleeding or an ovulatory bleeding. So some fertility issues that can cause this kind of situation are: number one, hormonal imbalance. Hormonal imbalance occurs when there is too high or too low of a certain hormone or hormones in the body. So the process of ovulation occurs when hypothalamus a part of your brain produces gonadotropin releasing hormone, which causes the pituitary gland to secrete follicle stimulating hormone and the luteinizing hormone, which are needed for ovulation. When gonadotropin releasing hormone is low in your body, it can actually lead to an ovulation. And an ovulation, what is this an ovulation? An ovulation is opposite of ovulation. It is a situation whereby the ovary is not releasing any egg. Number 2 cause of this fertility issue is a disease called polycystic ovarian syndrome. It is a condition that affects how your ovary works, and it makes it to enlarge with many small cysts on it, thereby causing irregular ovulation or no ovulation at all. Number three is family planning. The pills, those contraceptive pills, uses hormone to stop ovulation, as well as thickening the cervical mucus so that sperm cannot easily travel to fertilize the egg produced by the ovary. Number 4 fertility problem that can cause this is menopause. Once you reach about 45 years and above, your luteinizing hormone and the follicle stimulating hormone levels remains high, and your estrogen and progesterone levels remains low. Thereby, you cannot ovulate. And you cannot have a child. Number 5 cause of this fertility issue is diminished ovarian reserve. Now, when a woman is born, when a baby girl is born, the ovary contains the number of eggs that she will use for her lifetime. And these eggs in the ovary are diminished or reduced with age. And the eggs can be reduced or diminished by ovulation and certain disease in the body. So when a doctor says that you have diminished ovarian reserve, this means that you have low number of eggs. You have low number of eggs in your ovaries compared to your age, and it is sometimes called low egg count or low ovarian reserve. What are the signs of this ovulation? Apart from using your menstrual calendar to detect when you are ovulating, there is a way that God has made it that your body will tell you that you are about to ovulate or you are ovulating. What are those signs? What are those things that you will see on your body, and it will show you that, oh, I'm about to ovulate, or I will ovulate, or I'm ovulating? Number 1 is change in vaginal secretion. That is your cervical mucus. When a woman is about to ovulate, her body produces more of estrogen, and this causes an increase in secretion of wet, clear, and stretchy mucus that looks like raw egg white. How will you determine this? Just wash your hair. Make sure that your hands are clean. Bring out your thumb and the other finger. Just hold it like this. Deep down, put it inside your pint and bring out the mucus. Then release it small. If it stretches, that means that you are ovulating. But when you release it and it breaks, that means that you are not ovulating. So, and this watery and clear discharges helps the sperm in swimming to fertilize the egg produced by the ovary during ovulation. Number 2 sign is a painful sharp or dull clamp on the side of the abdomen when releasing the egg by the ovary. Those, you might not have every signs that I mentioned here, but you must experience one symptom of the other. Every woman's body differ. So if you're not expressing this, another person is expressing this. So number 3 is during ovulation, your sex drive will be high. You will have high sexual drive. Number 4 is breast tenderness. A tender breast or painful nipples is due to the flux of hormone produced before and during ovulation. The levels of estrogen and the luteinizing hormone increase, and the alteration in progesterone can result in pain or sore nipples in some individuals. Number 5 sign that you are ovulating is changes in the cervix. Changes in the cervix. Just before ovulation, the cervix will pushes higher. Just before ovulation, cervix pushes up higher, and it becomes soft to the touch and opens slightly. But when a woman is not in her fertile phase of her cycle, when a woman is not in her fertile phase of her cycle, the cervix will be lower, stiffer, and then more closed. So these are the signs that will be happening to your body, and you actually know that you are ovulating. See you on the next video. Bye.